few more minutes to get started. I am down waiting for you all to join me, and Stephanie, my communications director, you'll be able to hear her. She is on a conference call, or not a conference call, but on my phone. So she'll be asking me questions, and otherwise it will be just me. So we're practicing good social distancing.
So guys, I'm on speakerphone, and I will be relaying your questions to Celeste. If you have any trouble hearing me at any time during the broadcast, just type in the comments and let me know. I'll try to speak loudly and clearly. And like Celeste said, we'll wait just a few minutes and let some others join before we get started.
So I think I will go ahead and introduce myself while we're waiting on everybody else to get here. I'm Celeste Williams. I am the Democratic candidate for U.S. Congress here in Arkansas's 3rd Congressional District. I am a family nurse practitioner, former educator, former foster mom, adoptive mom, mom of 2 that I gave birth to, my biological kids, and I am running for Congress because I want to make sure that we have health care for all, that we have a world-class education system, and that workers are paid fair wages. And those are all issues that I could not solve in an exam room. And so after 23 years as a nurse, I am running for Congress so that I can better represent the people of my district.
Celeste, do you want to go ahead and start, since you are a nurse practitioner and you're working on the front lines during this very unique and unprecedented time of a pandemic, do you want to just go ahead and tell folks what you're seeing right now in your professional life?
So I do family practice, and in my clinic, we're not seeing patients in person as much anymore. We've transitioned to primarily telehealth in an effort to keep people safe so that they can socially distance from everyone else. And you don't want to come to a clinic when you are well and sit next to someone who is sick and may have the COVID virus. So that has been a huge change within healthcare. And then speaking to friends of mine who are in nursing in other areas, there has been a tremendous amount of preparation so that hospitals can prepare as best they can for the influx of patients that we anticipate. Fortunately, Arkansas has been a little bit under the projected curve, which is good. We are expected to hit the peak of this, the peak of the curve of number of people affected by this virus around about April 22nd, I believe, 19 days from now. And in that time, so if you think about that, most of the people that we expect to flood the hospitals have not yet even been infected. And so it is imperative right now that all of us do our part to prevent the spread of this virus. That again, there's no antivirals that are approved for treatment for this disease. There are no vaccines to prevent the spread, and so the only thing that we can do is prevent. And so, you know, number one, we need to stay home, wash our hands frequently, try not to touch our face, practice social distancing. And then, you know, one of the biggest hangups has been lack of testing. We still don't have enough tests. I think the criteria for who we are testing is still too strict. And, you know, the CDC is doing the best that they can with the limited number of tests that we have available right now. We continue to hear that that will be ramped up. And I know that it's coming. It's just that right now we still don't have enough. And so that gives us less confidence in the numbers when we're not doing widespread community testing.
Okay, so before we went live tonight, we had shared a link for folks to ask questions ahead of time. So before we hop on questions that are being asked in the comments, I'm going to go ahead and get to some of those questions that were submitted prior to our town hall tonight. The question number one comes from Jerry in Springdale. And this question, Celeste, is kind of about a difference between yourself and your opponent. This question from Jerry is asking, would you have a higher profile than our current representative, who I have not personally heard or seen from much during this current crisis?
So I think that absolutely right now it is imperative that our federal representatives are on the ground, being present, doing all that they can to hear from constituents so that they can relay what they're seeing back to Congress and take action. You know, one of the biggest problems has been that the federal government has not stepped in to help procure personal protective equipment and needed medical supplies, which forces states to bid against one another, the federal government, and other countries, which, you know, if ever there was a time for the federal government to step in, it is right now. So absolutely, you know, if I thought that Representative Womack was doing a fantastic job, I would not be running for office right now. So I think that in that regard, yes, I would definitely try to keep a much higher profile.
Thank you for that. The next question that was submitted, this one asks, do you think more emergency funds should go to everyday citizens or to giant oil companies and cruise lines in the midst of this crisis?
So I think that what has been a problem in the past is that a lot of our policy has not put everyday people in the center of what they're trying to accomplish. So no, I do not want more money to go in the hands of corporations. I want money to be given directly to the American people. And I want to make sure that I just think that trickle-up economics works much better than trickle-down economics. And too often with those large corporations, you wind up with stock buybacks and them reinvesting in their investors rather than their workers.
Okay, this next question kind of is in that same vein. This question says, most Americans know that rich and powerful have bought both political parties. Are you prepared to stand up against the establishment to get money out of politics, or will you be like all the others that start out clean and neat, but then once you're in Washington, D.C., will you fall into line and start supporting those rich and powerful and be business as usual?
No, I'm not rich and powerful myself. I am very much working class. My husband and I both require an income for us to make ends meet. So I think my focus is always going to be on everyday people. You know, I've spent my entire professional life or adult life working for everyday people across all economic and political spectrums, and I intend to continue representing them, not giant corporations. I mean, you know, we all know that everybody needs a job, and those jobs are important too, but I think that policy needs to center everyday people.
A follow-up question to that, big money has corrupted our democracy. What is the plan for you to involve more voices in our democracy?
So one is to really remain in the community, making sure that I hear from constituents and that I'm being accountable to them. I have not taken, nor will I take, any corporate PAC money, and so we will continue that. I do think that there's truth in the phrase that where your treasure lies, there also your heart is, And I think that it's important to make sure that I am working for everyday people. So on that note, this is a grassroots funded campaign. If you have not yet contributed, or you have and you haven't done it in a while, we could always use some help with fundraising.
The next question that was submitted prior to going live is, what is your position on increasing the federal minimum wage? I also see this one coming in the comments, so this is a popular question.
So yes, I absolutely favor increasing the federal minimum wage. So my entire life, which I'm 44, wages have been stagnating for working people here in America. And so the cost of living continues to rise, yet wages are not keeping up with that. And so I think it is very important to make sure that we are getting money in the hands of everyday Americans. And again, I think that trickle-up economics works where trickle-down economics has been proven numerous times not to work.
Okay, and this question is specific to Governor Hutchinson's town hall today. What do you think about his refusal to suspend evictions in Arkansas?
So that does sadden me. The CARES Act that was passed by Congress does allow for mortgage holders, if they are federally backed mortgages, to ask for assistance. And so if you are, it doesn't matter if it's you in your home and your personal place that you're living, or if you are a landlord, you can apply for assistance. And that way people do not need to be evicted from their homes right now, which will just continue to cause bigger economic ripple effects through our communities. And I certainly don't want to see more people on the streets right now or at any time.
Next question. Last Wednesday, the foreign ministers of the G7, including our Secretary of State Mike Pompeo, met virtually to discuss ways they could work together, but the meeting ended without the customary joint statement because the U.S. insisted on referring to the virus as Wuhan virus, quote unquote, rather than COVID-19, which angered our allies. What are your thoughts on this?
I think we just need to use proper terms that are non-derogatory to talk about medical conditions.
On March 29th, the Washington Post editorial board wrote that Russia and China are using this crisis to spread misinformation about COVID-19 in order to discredit the EU and the U.S. What do you believe our response to that should be?
So I think that we have to all be very concerned and vigilant about misinformation. We know that misinformation is being spread right now. It weakens our democracy. And so individually, we need to make sure that we are not sharing things that are not true. And as a government, we need to, one, step up and see what's happening and acknowledge it. And then two, put out truthful information to help combat that.
So this next question is kind of in the similar vein. It was also asking about President Trump and Senator Cotton's recent comments referring to COVID-19 as the quote-unquote Chinese virus. And do you believe this sends the right message?
Again, no, I do not. Just like any other medical condition or body part or anything else, we should refer to it with the proper name, which is, in this case, the COVID-19 virus, or you could call it the coronavirus.
Okay. We had a question from Harrison, Arkansas, that came in asking about your stance on environmental protection, and also another question specifically about your reaction to the Trump administration rolling back fuel efficiency standards on automobiles, the fuel efficiency standards that were put into place during the Obama administration. Maybe you'd like to answer those two questions at once.
So I think that we need to protect our environment. We all live on this planet. It would be nice if we have a habitable planet. And certainly rolling back EPA standards is moving in the wrong direction. I think that we need to stop subsidizing oil and natural gas and move towards more green energy. And fuel efficiency is certainly a part of more responsible energy.
Okay, this is kind of a longer question. In 2017, the president put a tariff on Canadian lumber. This had a dramatic effect on lumber prices. Congressman Womack has refused this whole time to release the dollar amount that tax has generated. This particular commenter is stating that he had one particular invoice that increased over $1,200 because of this tax. As we look at our nation's increasing debt and considering that weighted trucks inflict serious wear and tear to our highway system, he personally challenged Womack to request that tax money be applied to the highway system, and Womack responded that he supported the fuel tax for revenue, but it's this particular person's opinion that we need both. What is your opinion?
So those were two so I'll talk about lumber first. So lumber, I'm not in support of any tariff. That's not, that is causing everyday Americans to pay a tax because they're purchasing something from a different country, outside this country. So I'm not in favor of raising taxes on everyday people for goods that they want to purchase. And then what was the other part of the question?
About a fuel tax to help with the troubled highway system because of weighted trucks.
So, I think that every other country is paying more for fuel. So I will admit that I don't have a really well-formed opinion about that other than worry about having a regressive tax. I do think that we need to look at fair taxation. I don't think that it is appropriate for large corporations such as Amazon to continue to pay $0 in federal income tax. They're certainly using our roads and infrastructure to supply their factories with electricity, and then using our roads to deliver their packages. And I believe that everyone needs to pay their fair share, not just everyday people. Corporations also have to pay their fair share.
I'm going to take a quick moment to remind everybody who's joined recently that if you have a question, you're welcome to type it into the comments, and we will try to get to as many questions as we can. I also had somebody text to ask where they can go to donate to the campaign. I did put the Act Blue link in the comments as well, so people can go click on that link if they want to donate. Okay, so the next question comes from Carol. As a federal representative, what would you do to see that our nation is better prepared when the next pandemic comes?
So we have got to invest in a strong public health system. We have not been doing that, and the current White House budget actually continues to request a 15% cut to CDC funding. This is a budget that Congressman Womack has supported, and I am vehemently opposed to that. When you think about what the public health system looks like, that is everything from the CDC to your local health department. And at all levels, that system has been really divested from the state and federal budgets. And so we need to reverse that trend and make sure that we have the resources to respond to this type of crisis. In addition, I think that we need to make sure that we have a stockpile of needed medical supplies, which obviously PPE or personal protective equipment has been a huge problem right now. And certainly we want to make sure that those who are on the front lines of this are protected so that they themselves are at less risk getting sick. And, we need nurses and doctors and all health professionals to be able to be well and take care of us whenever we are sick.
We have another question coming in the comments asking your stance on universal basic income.
So I get this question periodically. I think that right now, especially in a crisis like we have, we now are up to 10 million Americans who are unemployed. I think it absolutely makes sense in the short run. I do have a little bit of a bias that I think that people want an opportunity, not necessarily free money handed out to them. Maybe other people have a disagreement on that. But I think that it is really important that we make sure that people have opportunity in the form of affordable education, make sure every single person in this country has health care, and that there are good paying jobs. So.
What about your stance on making venues more accessible to people with different capabilities?
Like making sure that places are wheelchair accessible and that kind of thing?
Correct.
Yes, I think that's very important. I believe that every human being has value, and we need to make sure that we create a society where everyone has access to the things in our communities that we all enjoy.
And what is your stance on paid internships?
I love paid interns. So again, if people would like to help me make that happen, you can contribute to our campaign, and when we have money, we absolutely can pay for more staff. I certainly believe that all work has value, and that we need to make sure that people are being paid for the work that they do. On the same token, if I don't have money coming in, especially like right now, there are a lot of people who are out of work, and so we don't have the amount of the ramp up that we would like to have right now in contributions. It makes it really hard to do that, and so I have to be a good steward of the resources that I have been given. And when I have the resources to do it, absolutely, paid internships are very, very important.
I'm going to take a moment and remind everybody watching that you can put questions in the comments. We have about 7 or 8 minutes left in our live town hall. I am also putting in the comments right now a link to Celeste's platform on her website. You can visit her website and read all she's running and all of the issues that are important and our stances on those things. Okay, another question, Celeste, is coming from Karen in Bentonville. Do you think the Trump administration should open ACA enrollment to those affected by this crisis?
Yes, I do. I think that that is a mechanism that we have in place right now. So I support that. I will also say that looking ahead in the months to come, we are facing a tremendous revenue shortage for state budgets. Right now we have a great increase in the money that states are spending, and a lot of these states, ours included, are constitutionally required to have a balanced budget. And so we're spending a ton of money, and we're all doing our part to socially distance and shelter in place and stay home. And so tax revenues are going to be way lower than what they normally would. And so one thing that I would really like to look at within the federal legislature is I would like to see those who are unemployed be able to enroll in Medicare so that they can get the care that they need right now. And I think that we're going to have such a big problem moving forward that the federal government is the best positioned to help solve that problem.
We have another question coming in from Kyle. If you were currently an elected representative, would you be urging our governor to issue a stay-at-home order?
Yes, I absolutely would. Again, as I said earlier, I am encouraged that the numbers are a little bit under what we had projected, but I continue to say that the people that we expect to come into hospitals in the next 20 days, ramping up to that peak, they're not infected yet. And so the most important thing that we can do right now is to stay home, shelter in place, and halt the spread of this disease. And so while I think it is great to hope for the best, we have to plan for the worst. And the best way to prevent the spread of this disease is to shelter in place so that we reduce the exposure that we all have to one another. And, it is very important right now to not pass that virus on. We get through this together if we all do our part. And so I think it's very important that we stay home.
Another question that came in was concerned. This person was concerned that the pandemic numbers and the severity were being overplayed, and they wanted to understand what you're seeing on the front lines and how this virus differs from a common cold or a flu virus, and if those viruses could have a similar dissemination and contagion pattern. Could you quickly explain the difference?
Yes. So let me kind of back up a little bit. So the COVID-19 virus there is no vaccine. There is no treatment for it. All we have is prevention. And also it is a much higher mortality rate. So the severity is much greater than like regular flu. Influenza, yes, people die from that, but not at the rates that we are seeing with the COVID virus. So, what am I seeing in my professional life, and then, I think also of other nurses that I talk to on a regular basis, including my husband who is an ER nurse. They're not seeing a tremendous influx of patients right now, but we're all watching the numbers increase daily. And so it is simply a math equation, looking at the numbers that we have now and knowing how transmissible this virus is and projecting forward what we expect to see in the coming days and weeks ahead. And so, I'm looking at data that is publicly available that I can look at, from work, that shows how many beds do we have available in Arkansas, how many ventilators do we have available, what are the projections from today moving forward, and what does it look like? And it's bad. We don't have the number of ICU beds, hospital beds, and ventilators that we need for the number of patients projected ahead. And so that is why it is so important for us to prevent the spread of this disease. Hopefully I've answered all of his questions.
I think that was answering that one. We have one last question that I'm going to follow up on, and then we will close out with one question that was pre-submitted. Kyle is asking, from a federal level, how can legislators work to protect the Second Amendment, but at the same time remove assault weapons from sale?
So law-abiding citizens certainly have a right to bear arms. My family is a gun-owning family, and so, it's very important to have safe storage. But it's also important for us to close the background check loopholes. It's important to prevent domestic violence perpetrators from having weapons. They've already proven that they have some violent tendencies, and that tends to be the group of people that uses those type of weapons. In we all think about like mass shootings. However, I think we also need to think about as well that gun violence includes suicide as well. And, you know, we need to make sure that there are extreme risk laws in place so that if someone is threatening violence to themselves or others, that with a court order that we can follow due process and take steps to keep that person in our communities safer. If you are a law-abiding citizen, you don't have anything to worry about.
Okay, so last question. This comes from Tora, and it's two questions actually, but I'm going to ask it as one. He wants to know, what is the best part about running for office, and what advice would you have for young folks who have a passion for activism?
The best part of running for office is all the amazing people that I meet. You know, it's limited now since it's through social media and a digital platform. But I still get to make phone calls and talk to new people, and I love hearing people's stories. And you never know what somebody is going through or what amazing life experiences that they've had that they'll share with you. And, you know, I am running for office because I want to make sure that the people here in Arkansas have someone who really is fighting for them in their corner and cares deeply for what they're going through in their lives and works very hard to make their life better. And what was the second half of that? What can somebody do to get involved? Is that what the other part of the question was?
Just advice you have for young people who have a passion for activism.
I would say that the most important thing to remember is that you are enough right now. What life experience you have had is enough, and that your passion and your dedication, get involved. You know, if you don't know something, there are people out there from whom you can learn. And I think that we are at a point in the world right now that we need all hands on deck. We need everybody of all ages to step forward and really do the hard work of reclaiming our democracy and getting civilly engaged and making sure that we are creating a better nation than we've had in a long time, and to make sure that we have a wonderful place for our children and future generations.
Well, thank you, Celeste. That's all the questions we have.
Thank you all, and I want to take a quick moment to really say thank you for all of the healthcare workers who are on the front lines right now. All the preparation that you've done, all the work that you continue to be doing, and all the difficult work that you will be facing in the near future. I'm there with you, and we're going to get together. So, great love for my nurse friends and doctors, everybody else. Love you all.